What up, everybody? For those of you on the YouTube station, this is the beginning of the podcast, sort of the raw version, just giving you an angle at how I move, how I dance, so you can give you a little bit of a visual to how I talk here. As you'll hear in a second, this is a podcast about my experience and my experiences and perspectives that I've gained through having a fight with cancer, surviving cancer, and still showing some signs of some of the distress and residue of surviving cancer. So that's what today's podcast is going to be a discussion about. Thanks for checking out my YouTube channel. This is a growing organic business. I'm looking to have the greatest impact possible. If you have any suggestions, please don't hesitate to reach out. Have a good day and enjoy. Hi everybody, my name is Joel. Welcome to the It's Nagelwish podcast. Today's podcast is, we're going to get right to it. It's about PTSD and cancer and how cancer survivors and their families and their caretakers and sometimes even their professionals, their healthcare professionals, are impacted by cancer, and where the cancer experience can trigger debilitating forms of PTSD. This podcast is brought to you by Fostering a Dynamic Impact. It is the change management company. I'm a motivational speaker and life coach, and I am here to have an impact. So take a minute, relax. If you're driving, drive safe, listen to my story. If you have any questions, please reach out. dynamicimpact.co, fatimpact@gmail.com. The information that I'll be reading to you outside of my story is brought to you from cancer.net. It's an impressive website full of resources and peer-reviewed journals. We're going to talk a little bit about the fear of recurrence and how that impacts people. And we're going to talk a little bit about how cancer impacts the caregiver in terms of not just the family who turns into the caregiver, but the nurses and the doctors that have to take care of them. The psychological health is going to be a big topic today. So my experience with cancer started when, and really the big change of fire in my life, I was just finding out I was going to become a father. I found a lump in my neck, which turned out to be thyroid cancer. I was 28-year-old male, so doctor after doctor's like, no way, it's just a cyst, leave it, it's not bothering you. But I was practicing martial arts, and for those of you who don't know martial arts or just understand regular basic function, there's a way to protect your throat when you bring your chin to your chest, and I was having some issues where I would do that and still sort of have some issues breathing. So you go to the doctors and like, no, you're a young man, you're in good shape, probably not a big deal, just leave it. So it starts to grow. I see an ear, nose, and throat specialist who's like, listen, there's a nodule on your thyroid gland. Oh, okay. I mean, I had been an anatomy and physiology teacher, but my neuromuscular life is more into the muscle and bone structure side of the body, not so much the hormones. So I was like, all right, no big deal. Well, what do we do? He's like, well, we're gonna, I don't know if it's cancer. They had done, the doctor said, I want to do a needle aspiration biopsy. I was like, listen, man, I've already been through 6 needle aspiration biopsies. For those of you who don't know what those are, it's a freaking long needle that they stick in your neck or my throat at that particular point to hit the thyroid gland to see if they could take a piece of it, test it, and find out if it's cancerous. So, and it's funny because doctors like, oh yeah, don't worry, it doesn't hurt, you're going to feel a little pinch. So we get to I get to this doctor, Dr. Mandel, who says, listen, I'm going to try you on some medicine. Since your labs look a little low, but you're showing signs of being hypothyroidal, let's see if giving you some medicine will shrink the gland and the nodule, and you'll be good to go. Which is an interesting discussion because he's actually trying to use Western medicine to let the body treat itself. Maybe there's something just not functioning properly with my thyroid gland, and it's enlarged and produced a nodule because it needs more tissue. So what do you do about that? The idea is you add some thyroid stimulating hormones to your body and that'll shrink it. So 90 days we go on this medicine. It was it was like every day I'd wake up, somebody poured a nice hot pot of caffeine coffee right in my head, and I was ready to go, like nitrous. The problem was it was overstimulating. So of course, 90 days into it, go back to the doctor, and while I'm feeling fantastic, the nodule in my throat is getting bigger, and because of the biopsies continue to come out negative, the only choice then was to go out and pull out the nodule because it's continuing to grow. So now, I probably didn't mention earlier, but with these biopsies, they kept coming back negative, 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 that there is no benign tissue, that there is no cancer. So I was like, all right. But the problem now, when you look back, is that if you were to picture a softball, and on one side of that softball is a growth. When you go blindly and needle biopsy part of that softball, you could hit that 1,000 times and never actually hit the part of it that's cancerous. So, okay, let's go in and take it out, whatever. And then I woke up from surgery and my family was standing around me. And I knew, so going in, the doctor said to me, the only way we're going to take out your thyroid gland totally is if you have cancer. If you don't have cancer, we're just going to remove the gland, you're good to go. Okay. Well, when I woke up, my family was standing there to tell me, everybody, oh yeah, we took your thyroid gland. Oh, okay. So, in that delivery process that you have, and that notifying me that I had cancer that way, I kind of appreciate, because I didn't have to worry, as much as most people. A lot of people who have a cancer of any type are plagued with the worry that they know they have cancer, and then months and months and months and months later, they have this kind of treatment. Months and months and months and months later, they have that kind of treatment. And although I had to endure that, it's not the same kind of angst to go up to the surgery part of it, right? So I wake up, okay, you have cancer. Now the good thing about waking up out of surgery is you're wasted. Now I didn't really know what was going to take place. I thought they were going to pull out a little nodule. I ended up waking up with 60 stitches in my throat and drains. So, okay, now you've got cancer. Well, now what? Well, now you have to prep for radiation. What? And not only do you have to prep for radiation, but you have to prep for radiation isolation. And, oh yeah, by the way, your son's going to be born soon. What? Okay. And this particular type of cancer makes you hormonal. What? What do you mean hormonal? What's that mean? So I was going to find out. I got so hormonal that during commercials, I'd be hanging out with my boys and I'd start crying. And they look at me like I'm nuts. Anyways, fast forward a little bit. This story isn't really about my struggle with cancer. Obviously, I endured all of it. For those of you who don't know, my son also had a liver transplant during that time, and he's doing that wonderful. But we get up to the, it's time to go through radiation, and to get to radiation, I needed to come off of all of anything thyroid stimulating. So that means anything with iodine or salt. So I have to eliminate everything with iodine or salt out of my body, and they tell me I'm going to get tired. What do you mean tired? Now this is before I'm even having any treatment. They just took out my thyroid gland, and I don't have any meds anymore. So now I'm getting tired. Like, I go to chew through a peanut butter and jelly sandwich, and the muscles in my jaw would be so tired they would go crampy. And because I was a stubborn idiot, I went to work a week later with all the stitches and strains in my neck and bandages just because I felt like I needed to do it. And I would get so tired driving 20 minutes, I'd have to pull over and take a nap. My body, because the thyroid gland was gone, lost its ability to use energy efficiently. So no matter how much I slept, no matter what I did, I was always tired. And I started to lose a lot of weight. So then it's time for radiation. Radiation with some spooky shit. So you get into radiation, and it's in a room at the Holy Cross Hospital, and they don't tell you much. They go over your background. They want to know what you eat, what you do, what your environment's like, and the nuclear physicians say, all right, well, come in this day, and you get into this room, and you go into this room. Now, inside the room, it's all, there's newspaper over everything. Over the walls, over the floor, in the bathroom, the urinal, everything. Now, mind you, along with losing my ability to use energy efficiently, your thyroid gland is also your body's thermometer, right? Like it's like your body's motherboard. So I lost my ability to deal with and acclimate to temperature. So 80 degrees outside and I'm freezing cold. Now I got to go into a hospital for what they're telling me is 72 hours of isolation, where I'm going to eat some radiation, and the radiation is going to attack any leftover thyroid tissue in my body and kill all the cancer. Any place that I sneeze on, I contaminate. Anything that I touch, I contaminate. Anything I sweat on, I contaminate. If I pee and there's some spray, I contaminate it. If I throw up, it's contaminated. So everything is disposable. Okay. So bring sours and water and things that you can drink so you can flush the radiation out of your system. Now, what they were doing before by taking the thyroid gland out of my body and removing any iodine and salt-based things out of my body, it would make my body and the cells in it so starving for anything salt and thyroid tissue that it would soak it up in any place in my body it might be. So the idea was that you eat this little radiation pill, and it has a bunch of thyroid tissue in it with little nuclear bombs on it, and they attach to any thyroid tissue and kill the cancer. Okay, simple enough. So I'm inside the isolation room, and they tell me drink a lot of water, but don't drink too much water because you can throw up, and if you throw up, you have to start over. What? But I'm thinking in my head, I don't want any of these little pieces of radiation stuck in the little crevices of my kidney or my body's filtration system or my throat or my tongue, which is where you do the research and find out. Because to go back to, well, we'll talk about what happened in a minute. We'll talk about my original diagnosis in a minute. But so I'm in the isolation room and I'm waiting, and the doctors, I'm it's about 6 or 7 hours as far as I can remember, and I hear security coming down the hall, and I hear them wheeling this tray. Now security has these suits on, and they wheel this, what's like a lunch tray, in the room and shut the door. Now the door is this huge lead door. These are all lead walls because of the radiation. And then they have this real thick plastic, like sliding door that goes back and forth so people can see me and assess me. No one can be within 10 feet of me for more than 10 seconds without harming their body, right? So the doctors come in and they put me in this, I'm in the room and I'm like, oh, hey, the security wheels the, medicine in, or what this lunch tray with a ammunition box, and they leave. Then from the door, they give me directions. And they say, hey, open this up with these big lead gloves on and pull out the bottle inside of it. And inside of it is a little radiation pill. It's a little regular pill, but it's got that radiation poisoning sticker on it. And you have these big gloves on, you unscrew it, you take it off, and you eat it. Okay. They leave. So the one good thing about being sick in a hospital is they never run out of hot water, and being cold intolerant from the thyroid cancer, I was able to just sit inside and just, oh man, it was brutal. So 3 days later, after they come in and read the Geiger counter with me, the little thing that does that clicking sound to see if I was okay to be around people, they let me go home. Now, mind you, my body's in this kind of surreal sort of chemicals processing state where I'm not really sensing emotions and just sort of going through the motions of life and not really knowing what I know now, where this was all part of the PTSD. The PTSD it was almost like a side effect of being able to survive it. Like the radiation, and the day I got diagnosed, running home and Googling what happens when you get thyroid cancer and finding out I'm going to die, oh my God, and looking at my mortality and learning now that was the dumb thing to do, right? Because it's not helpful. It wasn't helpful. I mean, it made me freak out. And because I was freaking out, and because I ended up in a place where I was traumatized, my body started to respond in a way that sort of rippled through everywhere in my world. So, for those of you who don't know, post-traumatic stress disorder is an anxiety disorder. It's something that can be developed after anyone experiences any kind of extreme, frightening, or life-threatening situation. PTSD is most often associated with traumatic events such as war, some kind of sexual or physical attack, natural disasters, of course, and of course serious accidents. But this podcast is about how PTSD affects people with a history of cancer. And there's actually research on it. Now, this study is based around those who have had breast cancer, and it's 1 in 4 women who are newly diagnosed with breast cancer experience PTSD. I would argue that goes across the board for any cancer. I know it did for mine, from being diagnosed, whether it's just the disease because the word cancer freaks people out, whether it's the diagnosis of some kind of advanced cancer, the painful tests and treatments, the anxiety of knowing you got to go into something that's going to suck that bad, and then not only do you have to do it today, but you got to do it 12 times over or all throughout the year or even more. And then you get through each one, and then all of a sudden you're waiting for test results. More anxiety. Contemplating things in your head that normal people don't do. Death, eulogies, what happens? What am I going to do? Long stays in the hospital. And then little things like every doctor's appointment, year in and year out, forever. It could be for me. I have something wrong in my throat. I get, let's say, strep throat somewhere, and I go to the doctor, and they're like, "Oh, okay." I'm nervous. I don't want them touching my neck. That's how it started before. And I get that anxiety. It was 5 or 6 years before I let anybody even touch my throat. And it's not abnormal. Worry, fear, dread, anxiety. I mean, this is part of being a cancer survivor. My point to you, to the people inside this podcast, to the people listening, or anyone you're around, all of us will, at some point in our lives, either know someone or be affected personally by cancer. It's important to understand that there's an impact long after just surviving the cancer, that there's a PTSD, that there's a fright to it. I remember every time somebody found out I had cancer, I would often spend time trying to console them. "Oh my God, you have cancer?" "Yes, I have cancer. I'm going to be okay." "Oh, you sure? What?" "Yeah." And they weren't trying to be rude or trying to be, all negative on it. They were responding to the word themselves, because the word cancer, on the other side of that for people is the word death. And on the other side of that is a lot of unknown. And that is nothing but fear. People don't want to talk about it. So when it's in their face, that's how they react. And if it's a child, woo, you get all kinds of reactions from people. Because it's stressful. And it really pushes that fight or flight nerve in our body. And it fosters things. Nightmares, flashbacks. You avoid places, people, events. For my son's transplant, which isn't cancer related, to my thyroid cancer fight, which both happened at the same time, there were years I didn't even want to go back into a hospital. And if I went, and when I finally did go back, it was emotional. I wouldn't watch sick things on TV, like where it shows up. I couldn't. I would go back to smelling the hospital I was in. And the body tells itself that emotions are painful then. Because, wait a minute, your body all of a sudden got sick. It kind of betrayed your trust. And now you can't really depend on it. You don't want to really depend on the emotions because they hurt, so you just block it all off. And that permeates our relationships and our work life and our decision-making process. And as you know, leads to depression, alcohol abuse, drug abuse, eating disorders, loss of relationships, loss of your job. Because you're trying to protect yourself from the emotional side and the emotional impact of all of that shit you're going through as a family too. It's not just the cancer patient, right? Because the family goes through it. It's extreme for them. Your friends and coworkers go through it. It's extreme for them. The risks are no joke. The impact can be great. All of these things that happen to you are going to make you more empathetic. They're going to create a platform for you to have a greater impact, right? They're going to make you stronger. And it's not clear why people have PTSD and some don't. Some people have longer treatment plans and don't get as mentally impacted by it. But it's real. It might not be a full-on PTSD anxiety attack, but it could be just small breaks in how you deal with stress and how you cope with things. Are there any avenues of your life that are starting to push towards excess? If things aren't in balance, it's a good identification that something's not right. There's a study that found that nearly 20% of families with teenage survivors of childhood cancer had a parent who was experiencing PTSD. I'm a volunteer for the Make-A-Wish Foundation. I've granted almost 50 wishes. I am around a lot of this, and I can promise you that that is an accurate study. You know what it's like trying to take your kid to a place that's going to hurt him or her? That there's a good chance your child's going to die, but no matter what, you got to take him through some of this? It's a big deal, man. And when you think about how many people are impacted by cancer, and then you think about how many people are impacted by the PTSD from cancer, you're talking about it permeating every arena of today's society. And it's important to identify. There are ways to get through it. You don't have to just crawl through it. I didn't understand the impact, so I never sought therapy for it. It was years and years and years of actually speaking in front of people where it started to unravel for me. And I learned what the impact was. There's psychotherapy. You can talk to a mental health counselor. People with experience treating PTSD. There's one-on-one group therapy. I'm no therapist. I am a life coach. I do help people with PTSD find purpose in their life, which allows them to add a strategic approach to how anxiety influences them. So it gives some extra boundaries. There's support groups. And ultimately, it's about identifying that there is a traumatic stress response. We all have fight or flight responses wired into our being. It's how we're built. And identifying how that influences your life is huge, because you're going to have traumatic events. None of us are going to live a life where there is nothing traumatic that happens. Identifying how that trauma influences your decision-making process, your relationships, your job, your health, your vices. Everybody has vices. Like if you're thinking to yourself right now, I got no vices, you got some shit. Whatever it is. If you find yourself leaning on it more than you did 3 weeks ago or 6 months ago or after some event, you might want to look at, hey, what's triggering that? Because it's like that shoelace that doesn't come untied, and you keep trying to just pull that knot so it undoes, and knot, and each time you pull it gets tighter. That's that anxiety ball in your life. That PTSD will compartmentalize in your brain. Somewhere in your body, in some ache and pain. It will show itself at some point in your life. The sooner you identify that it's there, the sooner you embrace how it impacts your life, the better your life's going to be. Now, what about our caregivers? The shortage of nurses and doctors in this country is staggering. That's going to be a whole separate podcast episode. But those that are treating us now, those that are in departments now that are treating cancer patients and cancer survivors, or the at-home health care, the at-home PT, the range of physical, social, psychological, and extenuating, the existential stressors that rattle healthcare professionals is impossible to quantify, but needs to be looked at. Because if we're trying to fill a national healthcare shortage crisis, then we can't burn out the people who are taking care of our most vulnerable. You're talking about looking out for people's self-esteem. You're talking about looking out for risk factors. You're talking about the basic fundamentals of care. For the whole impact, from patient to family to caregiver, to the people drawing blood. You can establish a culture. It is possible to establish a culture where all of that is encompassed in the healthcare delivery system. Instead, because it's the words PTSD, it gets brushed off with mental health, and as a society, we blow it off. And sooner or later, we're going to have to deal with mental health. That'll be a whole nother podcast. But we know it exists, but nobody wants to look behind the curtain and check it out. And for those of you who saw this podcast titled Cancer Survivor, Cancer and PTSD, and wanted to check it out, thank you. For those of you who weren't sure and just wanted to find out, at some point in your life, you're going to deal with people, you or your family, that have or are going to have a real critical illness or some kind of terrible impact that's going to traumatize you. Know that there's an emotional impact on top of the physical impact. Thank you for taking time out of your day to listen to my podcast. Check us out, dynamicimpact.co, fatimpact@gmail.com. We're corporate trainers, motivational speakers, and life coaches. any way that I can have an impact on your life, let me know. As a life coach, corporate trainer, like I said, we're here to add efficiency to your company. We're here to add gratitude and purpose to your life. Have a great day. Stay grateful. And enjoy.